Good afternoon and welcome to yet another exciting Facebook Live session with us here in KL Fertility Centre. And we have with us today the brilliant Dr. Natasha Noor, who will be talking to us about endometriosis and how this affects fertility. So before we start going on into the nitty-gritty part of this, we would like to remind you to send in your questions because today we'll be choosing 4 winners, 2 of whom will be receiving an exclusive free consultation with Dr. Natasha herself, and 2 more will be receiving this book, Catching My Baby Dust, Tales of Fertility Journeys to Inspire Your Own. So this is very exciting, so please give us your questions on the comment box below or send in a private message. Dr. Natasha will be more than happy to answer them for you. So Dr. Natasha, will first start with the basics of the topic today. So what is endometriosis?
Okay, so endometriosis. Hello everybody, good to see you for another session of fertility topics, and today I'll be talking about endometriosis. Now, endometriosis is one of the common diseases affecting women worldwide, and especially those who has problems with fertility. About 25 to 35% of women with subfertility problems will have endometriosis. Now, the basic of endometriosis is the lining of the womb, which is called endometrial cells, is found outside the womb. Now, we do not know why exactly this happens, right? But for some women, they have a tendency to have this happen to them. So now, when this lining inside the womb is outside the womb, it also reacts to hormones, right? So every month, it will thicken and it will bleed as well, right? So, but if you have the lining inside the womb, then it can bleed outside when you have your menstrual cycle. But unfortunately, with this lining which is outside the womb, it will also bleed, but it has nowhere to go, and it will cause inflammation within the lining of the abdomen, right? With inflammation, it could also cause scarring of the tissue, and this actually can cause fertility problems for some women.
Right? So Dr. Natasha, what causes endometriosis actually? Is there like a genetic predisposition towards it?
Right. So endometriosis, we don't know a lot of things about it, but we do believe that it could be a genetic factor and also environmental factor, causing some women to have increased risk of developing endometriosis. So if a woman has a family history of endometriosis, right? Maybe the sisters, the mother has endometriosis, she is at risk of developing endometriosis herself up to 7 to 10 times, right? Also, and now the other things is environmental factor as well, which we still do not understand a lot of things, but there are certain risk factors which may predispose the patient to have endometriosis, such as having period at an earlier age, less than 12 years old, maybe having shorter periods, right? We usually have a cycle, maybe 28 to 30 day cycle. The woman may have shorter cycles, such as less than 25. She may have longer period, means maybe more than 7 to 10 days, right? So all these could contribute to increased risk of having endometriosis.
I see.
Right.
Okay.
But it also can say, you know, women are having women at a later age.
Yes.
Right.
Okay.
So when we're starting to have babies at 30s, you know, our grandmothers and things are already being grannies or something like that. So I don't know whether endometriosis is something to do with being as a modern woman, right?
Yes,
a modern woman, we're changing the way we eat, our environmental is different, and we're having babies at a later stage.
Yes,
right?
exactly. So what are the symptoms like, doctor, to suggest that a patient could have endometriosis?
Now, endometriosis is a bit of an enigma, right? Because sometimes the women, they might have endometriosis, but they have no symptoms. So, but quite a few will have symptoms which may, which may indicate they may have endometriosis, such as some of the symptoms. They have heavy period, right? Prolonged period, and it's painful, right? And the pain actually of the period starts a few days before they actually have their period, right? Maybe about a week or a few days, and it's worsened during the heavy days of their period. and it can be debilitating in some women, right, causing them to seek further help from doctors and having the diagnosis of endometriosis. Some women may have difficulty with having sex, right? Sex becomes painful for them, and in other women, like they will have subfertility issues. That's all. They will have just inability to conceive, right?
Okay. So does this mean, like just now doctor said that you might have a patient with endometriosis most likely will have subfertility issues. How is this related? Why does a patient with endometriosis cause the patient to have subfertility issues?
Okay, so like mentioned before, about 25% to 30% of women with endometriosis, subfertility may have endometriosis. Now, endometriosis is basically causing inflammation within the lining of the peritoneum, which actually lines the abdomen and the pelvis, where the reproductive system sits. Now, when it's inflamed, it has a toxic fluid, which causes adverse effects on the eggs and also on the sperm. So that will reduce the chances of conception and fertilization. It also, with the adhesion, right, caused by the inflammation, it will also causes damage, right, to the ovaries, right? They will develop cysts sometimes within the ovaries, right? There's an accumulation of old blood, which we call chocolate cysts, unfortunately, because it just looks like chocolate, right? Right? And this will be seen intraoperatively, right? You puncture the cyst, it comes out with old blood, it looks like chocolate. So chocolate cyst most likely is associated with endometriosis, right? And also it causes tube to be damaged and distorted, right? So when the tube is damaged, distorted, it's blocked, so the eggs can't meet the sperm, so you can't have the implantation of the fertilized egg. Now, so these are a lot of other factors. Another one, it's painful to have sex. So women will probably just avoid it, shy away from having sex, so lessen their timing of sexual activity, and this would definitely contribute to reduced chances of conception.
I see. Okay, thank you, doctor. So, is there does this mean that if a patient has endometriosis already, it automatically means that they are unable to conceive? Is there like a staging of it, of endometriosis or such?
Okay, so not necessarily that just because you have endometriosis doesn't mean you can't conceive normally, right? There's lots of patients who does have endometriosis but they conceive normally. But this depends on a few factors, whether what stage of endometriosis she has, her age, whether her sperm, her partner's sperm is okay or not, right? So that also contributes, right? So if she has a severe stage of endometriosis, now endometriosis can be staged, but usually this is a diagnosis stage at surgery, right? Not many women will have it, but you can be staging the endometriosis depending what we find intraoperatively to stage 1, 2, 3, and 4. So stage 1 is mild disease or minimal, and 4 being severe, right? When you have severe disease, basically they will have cysts, right? Lots of adhesion inside the peritoneal cavity, tubes are being distorted, so it makes it more difficult for the patient to get pregnant. Right? So all of this actually contributes. So if patients actually suspect she may have endometriosis, or if she thinks that she has some subfertility issue, the main thing is don't delay seeing a doctor.
I see.
Right? Especially if she's got stage 3 or 4 endometriosis, it's best to see a fertility specialist because she might have challenges in conceiving, right? So the chances are better with fertility treatment, right? So, and the younger they are, the better.
Okay, good. So doctor, say after the patient has already decided, they might have symptoms of endometriosis and they come to see a doctor, how would a doctor investigate that patient?
Right. So it depends on the background, right? We see what symptoms the women have, what's causing her issues. Because some things concern the patient a little bit more. Some would be pain, other women would be fertility, right? So we would then tailor accordingly to what the patient wants. But for us, it would be fertility being on the firstly. We would take a history. We also would test for other tests, especially like the husband. And basically, she will have a scan, right? Usually the scan is done internally. Means it's a vaginal scan. And we'll have a look at the uterus. We'll have a look at the ovaries, see whether there's any cysts, right? And then we'll look at the position of the ovaries, because sometimes the ovaries, if it's distorted, it's the position it's being at a different level, right? So this would complicate things such as IVF, because when you do IVF, when you do an egg pickup, everything's done vaginally. So the eggs, the ovaries needs to be accessible. So when you have endometriosis or when you have adhesions, sometimes the ovaries become stuck behind the uterus and it becomes inaccessible to egg pickup for the IVF. So some patients actually come after the operation, right? Surgical operation, maybe they see a gynae, say some fertility, they have the operation because of cysts or something like that. When they come, eventually they can't get pregnant. They come to do IVF, we'll say, look, your eggs is still high up, it's inaccessible. So this could have been done right during the procedure itself, during the operation. So my advice, if a patient have a cyst especially, and she may have endometriosis and is planning for an operation, it's best to also see a fertility specialist to make sure that, you know, in case in future she needs to move on to an IVF treatment, that things are taken care of during the first round of the operation.
Exactly. So at the same time, two birds in one stone.
Yes, correct. And prepare herself better for the operation and also for the next fertility treatment.
I see. So in this case, the treatment will be based on treating the fertility issues and also treating endometriosis per se.
Symptoms.
So both things.
Yes, we can do that as well.
Okay, so doctor, so is there, like, because when we were doing our reading, we've heard this myth that pregnancy, if a patient is already pregnant, it will relieve the symptoms of endometriosis.
Or
is that
cure it.
Cure.
Okay, now it would not be totally cured, endometriosis with pregnancy, but because when you are pregnant, you will have no menses for 9 months. So that would actually stop any residual endometriosis implant from growing, right? So it's just being suppressed.
I see.
Right? But it's not uncommon to see patients for the first baby with endometriosis having issues in getting pregnant, needing IVF, then getting pregnant with the IVF. Subsequent baby, she is just conceiving naturally, right? Because you know it somehow is being suppressed, mellowed down, and you know fertility rate, and perhaps she's a bit more relaxed, right? More less stress, not thinking about babies all the time, and these things she just conceived naturally. So like, you know, again, IVF is not at the end of the road. A lot of patients wait until it's quite late at stage, age goes up, right? And it actually reduces the chance of them getting pregnant, even with IVF.
I see. Okay. So thank you, viewers. We've been getting a lot of questions today, surprisingly. Thank you very much. So stay tuned for the 4 lucky winners. Okay, the first question is, Doctor, could you elaborate more about the type of food that a patient with endometriosis should or shouldn't take?
Right. So diets for endometriosis, if you were to see, actually I do believe that, you know, you are what you eat, right? If we eat crappy foods, you don't expect to have a healthy, glowing, beautiful skin, you know, functioning properly. So with endometriosis also, we know it is an inflammation process, right? It's probably estrogen influence, it's a hormone for female. So first things about food, you need to eat healthy, balanced food. Right, healthy balanced food so that your immune system is functioning well. I see. Right, because some people actually develop endometriosis because their immune system is not clearing out the deposits which is outside the uterus clearly, properly, right? So their immune system is down. So you want to have healthy food, lots of fruits, lots of vegetables, simple things, you know, it's the simple things back again. Get back again, yes. Get back, drink lots of water, warm water, no, actually it's just plain water. 8 glasses a day, right? Lots of fruits, lots of vegetables, avoid things which have excessive estrogen, right? Sometimes you hear lots of stories about soya and tofu. I mean, if you're not a die-hard fans of all these, you know, soya products, you can reduce it a little bit, right? Because obviously there are lots of research, sometimes it's conflicting, but there may be some evidence to show that it could adversely affect, and some women are more sensitive to it, so we'll reduce this. And also you would also increase your intake of fruits and vegetables, reduce your intake of sugar, coffee, even decaffeinated. Yes, coffee actually contains estrogen, and also it actually alters the balance of your sugar levels, right? So coffee, but If you're a coffee lover, it's okay. Less than 1 cup of,
Okay.
right? A cup a day, it's fine,
Okay.
right? Fatty foods, we shouldn't have that. What else? Go for organic food, because sometimes they inject hormones, right? So you will go more for organic food, less red meat, right?
Oats maybe?
Yes, fantastic. There will be whole meat. Again, it keeps your gut functioning well, right? So when your liver, your gut is functioning well, it clears out all the toxins in the body. So you need to have healthy, clear up the toxin, and then have good immune system.
Okay.
Right.
So to conclude, good food, good health. Good.
Yeah.
Okay. So, doctor, another question: Can a patient have fibroid together with endometriosis?
Again, fibroid is another condition which is known due to excessive estrogen.
Okay.
Right. It causes growth.
Okay.
Right. Of fibroid, of endometriosis. Now, patients not uncommonly have both together.
Oh, okay.
Right. So yes, patients may have fibroid and endometriosis occurring together, and obviously this will make conception even much more difficult for these women, but not impossible.
Okay.
Right. So it depends on each individual.
Okay. So, doctor, another question. This patient is on hormone pills for endometriosis. So, how to increase the chances of pregnancy?
Right. Some patients, when we have endometriosis, they have painful, prolonged period. So these patients are being put on oral contraceptive pill, mainly to regulate their period. Okay, when they regulate the period and when they are on regular hormone pills, they will find that their cycles or their period becomes regular, lighter and shorter.
Okay.
It's just because that the hormone manipulates, it makes the lining of the womb thinner.
Okay.
So that helps a lot with patients. But obviously if she wants to get pregnant, she has to get off the pill.
Okay.
Right, but what we sometimes give it just to alleviate the problem and maybe suppress a little bit the endometriosis before going on to the next fertility treatment which is suitable for her. So it could be an IUI, it could be an IVF, or if it's not severe, she can try natural conception. But again, move on quickly, because with severe endometriosis, chances are that her tubes are damaged, the ovarian tissue has better egg quality and numbers, so she needs to probably conceive with IVF. But it's not for everybody, right? We will tailor accordingly to each patient.
Okay. Okay, another question. This patient has a cyst in one of her ovaries due to endometriosis. So should she remove her ovary, and if so, will this affect her chances of being pregnant?
Okay, now the cysts, we try not to remove ovaries because we love our ovaries. We need to get eggs from our ovaries. So if she has cysts in her ovaries, we try to best as possible to remove only the cyst.
Okay.
Now, what's the problem with removing the cyst is that it's stuck to the underlying structure of the ovaries, where the follicles, the potential egg that we want, is also there. So if you were to remove a cyst, it might also damage the underlying ovarian tissue, and also it could potentially reduce your ovarian egg reserve, right? Because I've seen patients with huge ovarian cysts due to endometriosis, remove the cyst, she has irregular period after that, and she's actually menopaused. Because from the severe endometriosis and the operation, it actually has
like a pseudo-menopause state.
Yes. So she's totally, a bit difficult in that situation. So we have to be a bit more careful when removing cysts, especially for repeated cysts. Right? We do not encourage to remove cysts repeatedly because it will be there forever, and the possible risk that it might affect the ovarian reserve. So have the first operation for diagnosis, because we want to make sure that the cyst is not malignant, and also we'd like to stage and we'll do a good job the first time and quickly get the patient pregnant.
Excellent.
A lot of patients, they wait after operation 1 year, 2 years, and some patients, if they have severe endometriosis, the cyst actually recurs back again within 6 months to 1 year after the operation. So soon. So you're back to square one, having another cyst, right? So with endometriosis, I tend to be a bit more aggressive. Even though patient's younger, I see, because I know this is going to be a lifelong disease. It will keep coming back. my job is to get them pregnant as soon as possible.
Yes.
Right?
Okay, so when will the proper time be to go for an IVF after endometriosis surgery?
Okay, it depends on the patient's age, but usually I would probably wait at least a good 2 months, right, so that the patient will recover, and also the operation, because most of the time it will also involve the ovaries.
I see.
Right, so at least a minimum of 2 months
Okay.
before we starting the IVF cycle.
I see. Okay. So is it normal to have endometriosis after C-section? Cesarean section?
Not common, but there's a possibility that the patient already might have endometriosis before the cesarean section.
I see.
And it's very rare complication is that the lining of the endometriosis actually occurs at the scar outside of the cesarean scar, and it bleeds. So that is very unfortunately, but luckily it's very, very uncommon.
Okay, that's good. That's really good. So doctor, just now we were talking about hormone pills, a patient being on hormone pills for endometriosis. What are the other options to treat endometriosis besides these hormone pills?
Okay. So firstly, let's say if the patient have possibility of having endometriosis, depends on her background. Let's say she has a cyst, right? And she's keen to conceive. My first advice would probably be do an operation, have a look, stage it, remove the cyst, try to reduce, try to actually repair if there's any adhesions intraoperatively, and that will help sometimes with the tubes, because sometimes the tubes is just distorted. So by removing the adhesions, and then diathermy, like what we do, we just use electric and burn the small little spots within the peritoneal cavity, and remove the cyst. Sometimes what happens after the operation, patients get pregnant. Right. So if it does not, I would say, okay, let's say the tubes is severely damaged. Husband has some issues as well. She's a bit older, prolonged subfertility. We'll say, okay, we are going to just remove the cyst, make sure it's fine, try to optimize things as much as possible. If within the 2 to 3 months you're not pregnant, we're just going to proceed with the IVF, right? Sometimes we do give treatment, hormone treatments to suppress things, endometriosis. There are pros and cons for doing this, so it depends again on the patient, and we'll have a discussion whether this is appropriate for her to be suppressed with the hormone treatment or not. So you'll have surgery, you have contraceptive pill, hormones, which is taken orally, or you might have also injections. Right? Injections is usually monthly injections. I would advise patient, perhaps it's better, especially if she's thinking of fertility treatment, to have the hormone injections monthly instead of, because sometimes there's a higher dose, you can give it 3 monthly. But I find that it suppresses the period far too long. Right? If it's monthly, when you stop the injection, you should have a period 2 months time, 3 months time, right? But if you take the injections which last you for 3 months, sometimes your period is so long that some patients don't have a period after stopping the injection 6 months, sometimes a year. That's precious time to me.
I see.
Right? We'd like to get her pregnant
as soon as possible.
Yes.
So doctor, we have a very another question. So how does adenomyosis differ from endometriosis?
There are different types of endometriosis. Now, adenomyosis is a different type of different kind of endometriosis, where actually the lining of the womb, right? If I can show you a photo, right? Show you a photo, right? We'll just probably have a look. Okay, so this is actually a photo of the female reproductive system. So you've got the vagina here, down here, you've got the cervix here, and you've got the uterus here, you've got 2 tubes here, and you've got ovaries right and left. Now, this is the lining of the womb, okay, and this is the muscle layer of the uterus, right? Our uterus is consists of muscle layers. Now, adenomyosis is when the lining of the womb, it actually invades into the muscle lining of the uterus. Now what happens there, it causes implantation issues, right? So patients might have implantation issue, issues, right? It's a bit more difficult to implant, and also that the uterus, if you were to scan, becomes bulky, and they may have painful, heavy periods, right? So there's, it's not easy. Some people do surgical treatment for it, for which I'm not a big fan of it. I just hate cutting things, to be honest, right? Because I feel that we can do a lot of other things that will be second line or the last resort, right? For adenomyosis, what we need to do is improve the blood flow sometimes, and there's several ways of doing that, and does not include surgical treatment. But obviously, in some cases, they might resort to surgery to treat the adenomyosis, right? So now, endometriosis, it could affect women in different ways, right? If you were to see here, it might affect the uterus, right? Because of the adenomyosis, where the implants goes into the muscle lining, or it might affect the tubes, because the tubes becomes distorted due to adhesion, becomes blocked, becomes dilated, or it might affect the ovaries, where there's cysts inside the ovaries, so that actually prevents the eggs from coming out, and the egg quality and the number is reduced because of the endometriosis. In addition, the lining outside the uterus, the peritoneal cavity, right, becomes a toxic environment for the eggs and also for the sperm. So that all reduces chances of conception. But again, most patients with proper treatment will have their child, right? And we'd like to help women, especially with endometriosis, to conceive, right? With whatever treatment that's suitable for them.
Thank you, Doctor, for the very concise explanation, or such a short and sweet explanation on endometriosis. I believe that's all the time we have today for this session with our brilliant Dr. Natasha on endometriosis and how this affects fertility. But before we go, we have a very exciting news. Dr. Natasha will be hosting a free seminar on steps to increase your chances of successful IVF treatment, and this will be on the 5th of November from 2 to
4th November.
4th November, okay.
I was remembering something else.
4th of November from 2 to 4 p.m. at DC Mall, Bukit Damansara. Don't worry, we'll put in more information in our Facebook page. Please do follow our Facebook page and get a chance to meet Dr. Natasha in person to address all your issues regarding infertility or whatever it may be. Alternatively, you can also call and make an appointment with KL Fertility Center to meet Dr. Natasha, and go on to Dr. Natasha's blog site. She has a blog site. It is drnatashanorfertility.com, where Dr. Natasha posts inspiring stories regarding the fertility treatment and also topics on fertility per se. Okay, so thank you everyone for tuning in this time, and thank you all for the questions. The 4 lucky winners will be chosen and be contacted by our KL Fertility team very soon, so stay tuned for that. Thank you, Natasha, once again for such a brilliant topic to talk about today, and thank you everybody for tuning in. That's all from us today. Bye.
Bye.